morning, everyone. Welcome into a very quick little lecture on our medical terminology. All right, this is going to be pretty basic, and it might be some things that you've already heard of, but I promise it's going to be beneficial to breaking down more complex topics on the NCLEX and understanding what they're asking you, even if you don't totally know what the word means. We're going to start off looking at some suffixes, those endings to words. We have quite a few that tell us about the type of procedure that our client is having. For example, when a word ends in apheresis, we're talking about the removal of something. So a common example is plasmapheresis. Plasma is removed, treated, and returned to the body. Now, if the word ends in ectomy, we're talking about a surgical removal. So an appendectomy, a colectomy, right? Removal of that organ. If we see a word ending in scopy, S-C-O-P-Y, we're talking about a study or examination. Endoscopy, a study inside the body. Colonoscopy, a study of the colon. Okay. Lastly, stomy means a surgical opening. Tracheostomy, opening in the trachea. A colostomy, opening in the colon. An ileostomy, opening in the ileum. Yeah? Now, here are a few suffixes specific to our oncology clients. When we see a disease and it ends in carcinoma, we know that that cancer is originating in the skin or tissue cells of internal organs. Versus if we see a word ending in sarcoma, that cancer is originating in the body's connective tissue, like that osteosarcoma in the bone. Now, words ending in penia, P-E-N-I-A, mean a lack of, a deficiency of. Neutropenia, not enough neutrophils. And plasia, kind of the opposite, is when we have excessive growth or development. So a neoplasia, an abnormal growth. We have several suffixes when it comes to our anatomy and physiology as well. For example, when you see words ending in emia, we're talking about the blood. Anemia, lack of blood cells. Septicemia, infection in the blood. Versus when we see words ending in urea, we're talking about the urine. Polyuria, excessive urination. Hematuria, blood in the urine. If we see a word ending in site, we're talking about a cell. Ending in amnios, we're talking about amniotic fluid. And ending in thorax, we're dealing with the thoracic cavity, the chest cavity. A hemothorax, blood in the chest cavity. A pneumothorax, air in that pleural space in the chest cavity. Now, we also have several words telling us not just about where, but specific changes occurring in our anatomy. For example, megaly. Any word ending in megaly means it's growing bigger, irregular enlargement. Cardiomegaly, irregular growth of the heart. Trophy also means growth, hypertrophy, growth of that organ or tissue. For example, in our PEDS lecture, we talk about left ventricular hypertrophy in certain cardiac defects. That left ventricle abnormally grows bigger, hypertrophy. Stenosis is when we have a narrowing. So we talk about this a lot with valves, arteries, veins. If it's stenosed, it's abnormally narrowed. Aortic stenosis, mitral stenosis, versus sclerosis is hardening of a tissue. So atherosclerosis, hardening of arterial tissue, the lining of that blood vessel. We see that in that coronary artery disease, peripheral arterial disease, peripheral vascular disease. And lastly, stasis. This means that something is staying still. Remember, venous stasis, the blood in the vascular system is staying still. Hemostasis is when the blood clots. It's not flowing anymore. It's still. So stasis is still. Now let's look at some suffixes that can clue us in about our assessment findings. Algia means pain. And the first part of the word will tell you where it's occurring, like myalgia is muscle pain. Cele, C-E-L-E, tells you it's a hernia, like omphalocele, where those abdominal organs protrude through the umbilical sac in a newborn. If you see something ending in emesis, it has to do with vomiting. Hematoemesis, for example, bloody vomit. I bet you know this one already. If you see something ending in itis, you've got inflammation. And whatever the first part of the word is tells you what's inflamed. Appendicitis, inflammation of the appendix. Pancreatitis, inflammation of the pancreas, so on and so forth. Paresis means paralysis, and partial paralysis specifically. So hemiparesis, you've got weakness on one side of the body, only partial paralysis. Versus plegia, we have total paralysis. So hemiplegia, paralysis on one side of the body. Now, a few miscellaneous suffixes that I bet you've seen already. When something ends in penia, we're talking about breathing. Bradypnea, slow breathing. Tachypnea, fast breathing. Ending in rage, that R-R-H-A-G-E, that's when something is flowing excessively, like hemorrhage. Phagia has to do with eating or swallowing. Dysphagia, trouble swallowing, right? Polyphagia, excessive eating, excessive hunger. And phobia, of course, is a fear. We have many phobias. One example here, acrophobia, that fear of heights. Now, these are great little tricks to help you pick apart words and figure out exactly what those complex terms on the NCLEX are really talking about. Paired with prefixes, that first part of the word, you might even be able to identify what a word means that you've never heard of before. So for example, some anatomical prefixes you'll likely see on the NCLEX. Myo refers to muscle. Myocardium, muscle of the heart, easy peasy. Chole, bile or gall. So cholecystitis. We see gallbladder, itis, inflammation. Cholecystitis is inflammation of the gallbladder. Or similarly, cyst means bladder. Cystitis, inflammation of the bladder. Boom. Even if you didn't study cystitis, you now know what you're dealing with. We have tons of prefixes dealing with the position of things in the body. Ante, before. Antepartum, before childbirth, right? Post, after. Postpartum, after childbirth. Endo means within. So remember one of our suffixes, oscopy meant study. Endoscopy, a study within the body. Boom. You know exactly what that word means. Epi is the outer layer, like your epithelium, that outer layer of tissue. Hypo, low, hyper, above, right? So hypovolemia, volume. Emia, blood. Hypo, low. Hypovolemia, low blood volume. Boom, easy peasy. Inter means between. So for example, intercostal, between your ribs. And intra means within. Intravenous, in your vein. You guys know pre and post. Sub is below and supra is above. We use those words a lot when we're describing where a symptom is occurring on our client. For example, a supraclavicular retraction. We're having retractions above that clavicular bone. That tells me where the retraction, where that work of breathing is occurring in my client. And trans means across. We have prefixes as well that tell us more about the speed at which something is occurring. Brady, tachy, and dys. Brady means it's slow. Bradycardia, bradypnea, and contrarily, tachy means it's fast. You've heard of all of these things before, but when you pull apart those prefixes, you can apply them to anything you see on the NCLEX. Dys means abnormal. Dysrhythmia, abnormal rhythm. Dyspnea, abnormal breathing, right? We can also use prefixes when we talk about size, all right? So macro is something that's big, like macrosomia, somatic, a body. Macro large, macrosomia is a large body versus micro is small. You already remember hemi means half because when we talked about paresis or plegia, weakness or paralysis, we said hemiparesis, partial paralysis on one side. So hemi, it's happening on half. Paresis, that partial paralysis. Boom. Nulli means none or the absence of. So a nullipara, someone who has never given birth. Multiple. A multipara, someone who has given multiple births. And neo means new, neonate, like a new baby. So again, these are common terms. These are words and little pieces of words that I'm sure you've heard of. But taking the time to know what they indicate and pull them apart can really, really benefit you on the NCLEX. When there's a big, long word and you're just not sure what it's talking about, come back to this medical terminology lecture, break that word apart, and see if you can figure out what they're asking you about. I promise it will be worth it. All right. Thank you for your time and attention on this short little lecture. Again, my name is Morgan, and I'll see you guys back here next time.